Suamey is the president of the Liberian Nurses Association, and Theophilus T. Faya, the president of the Liberia National Physician Assistant Association. They here. Gentlemen, good morning.
Good morning, and good morning to the listening audience, and good morning to my fellow nurses that I refer to as the guardian men and women in white.
Mm.
I say good morning, and I will always appreciate them for the sacrifices in ensuring that the health needs of our countries are met. And so, good morning. I'm Benjamin Suamey, like you rightly said. I'm the president for the Liberian Nurses Association.
Great. Mr.
So,
Faya?
so good morning to my fellow colleague, most especially all male low health clinicians, to be more specific, the physician assistant, which of course are the one that elected me to speak officially on behalf of them. And let me say hands up to all those in the 15 countries that are currently on duty and sacrificing for other people to live. And good morning again to the listening audience and Liberia at large. Thank you very much.
Great. So we've got, you here regarding what's unfolding in the Southeast. Some health workers of the Southeast under the banner Southeastern Health Workers Association are today, or maybe today, kicking off a strike action for, salary and all that. What is the position of you authorities, especially basically you are the heads because you Benjamin is the president of the Liberian Nurses Association, and you are the president of the Physician Assistant Association. What's happening? Give us a background. Let me first start with you, Benjamin. Give us the background about why is this happening.
Okay, so let me conclude before I give you the background. But it's so let me tell you what I wrote last night in the Telegram, the general chat room of the Liberian Nurses Association.
Okay.
I will want to read it and be on the record for it. And I have your fellow nurses from the southeast counties. Please do not engage in any strike action tomorrow. Doing so will be at your risk, will be risky to your job. That your counts for the strike, for the plain strike action are as important and legitimate. However, the planning of the strike, the planning process, however, the timing and the process employed in the planning of the strike do not guarantee your protection. While it remains clear that we are, why it remains clear that we were not respected and consulted by you, we have engaged the government on your count for the strike. The process for dialogue has started as some members of your leadership are en route to town for meeting at the expense of the government. Please wait for the result of this meeting. Engaging in fragmented strike action gave the government very easy means of replacing you. We we have come out with press release where they're gonna attach. Please take note that the very reasons for which you are striking are the reason why we engage in government for adequate at every given opportunity. So this is my concluding statement that I wrote in the article in the Telegram chat room last night. What is the background? At some point in time in 2022, that was last year, I understand some health worker under the banner Southeastern County Health Worker Network
Mm.
planned a strike action last year. I don't know whether the strike took place, But I understand the reason for the strike was low salary, bad working environment, people volunteering, salary disparity, insurance company, not something about the side insurance company. There were 7 counts. I can't remember everything.
Mhm.
So I understand with that, the government of last year, but that did not consult any of the leadership in Monrovia, work directly with them, recognize them. I understand they were giving laptop and some money to expedite. They going to do independent verification and send to government people who are on course and people who are volunteering and evidence of a salary disparity. So with that last year, that was the end of the strike last year. Then I understand last week they have also come out threatening to go slow, that those counts were not met. But before that, I understand the government had increased some of them salaries, especially taking nice A salary, I think from on the week level to 200 or so forth. Of which I think 100 now I think of which 825% benefited, almost 90% of them from the southeast. Then they have come up and saying that they want to go slow. That which is not a problem because the very reason they're going slow for are the very reason we're talking on every day. But I understand when we were called, but then now for the minister, the government had now known that we exist as their leaders. They call us. We have gone for dialogue.
Mhm.
The 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 authorities or their leaders are even fragmented. I understand the leaders are even fragmented because they have actually placed, they put the ostracize the chairman and the vice chairman. They have created different chat room where the vice chair and the chair they are no longer in that chat room.
The southeastern health
Yeah,
workers.
yeah, that is not even the issue. The government, those guys who are even had the fragmented chat room,
Mm.
the government had expedited their transportation to Monrovia for dialogue. So I was there and I call. I understand how much they sent to them, how much they didn't send to them. I don't know. But they acknowledge the government sending expediting their transportation to Monrovia. Where came our issue? We have got in the negotiation, and after the meeting day before yesterday, it was very nice that we are waiting for them to come so we can amicably conclude the accounts. Prior to that, yesterday we have got a news that while they are en route, they have issued another statement that
Mm.
while they are en route coming, the strike action should take place while they are coming to Monrovia. And we saw it as not actually being fair
Mm.
because you want dialogue and they have called you for dialogue. I have not come to criticize the process because they are our children. If your children go wrong, at some point in time, you will bargain when you get in how to discipline it. So I have not
So
really come
let
publicly
us
to.
understand what is the basis for which they want to
The
strike.
basis for strike is low salary, high number of adequate unemployed nurses or unemployed health workers, salary disparity. Those were the basis. Side insurance company deducting money and private facility are not in those places for them to benefit the money. Those are some of the counts.
Mm.
But these counts are very legitimate and important. But remember, they are the very counts that we engage in government on and talking on every day. And remember, they are not also unique to the Southeast. These counts are unique to the entire country.
Mm.
We have not come here in the studio to acknowledge the wrong, because the wrong was acknowledging Southeast. Because if you acknowledge Southeast and leaving the national authority, the leadership, the next thing is you acknowledge the North, you acknowledge the South, you acknowledge the East. You start acknowledging the Northeast, the West, all of those things. So that was the wrong that was we had not come to dwell on.
Okay.
Acknowledging then was actually the problem.
Okay.
But saying the issue here now is we are engaging, we are told our guy, do not engage in the go slow because you are already said you want dialogue, and your colleagues are in route coming for dialogue.
Okay.
So yeah, so then why were you engaged in go slow?
Okay, let me come to you, Theophilus. So the health workers, these health workers are, planning to strike. Are they a mixture of physician assistants, nurses? Do we have doctors amongst them? Who are
Oh,
they? Let's first understand their categories.
so thank you very much, Varflay. You don't want to talk about salary disparity and insurance issue is dominant among male level health care workers.
Okay.
The male level health care workers include the physician assistant, the nurses, the midwife, the laboratory, the nurse assistant, even the cleaners in the hospital, and all of the securities are part of that grouping.
So we know that
Yeah,
these people that are having a problem,
Yes.
these are the
These-
categories.
These are the categories.
Okay.
So the doctors, I cannot speak for them because I don't know whether they have issue, but we know that is the male level health clinicians that we are speaking on behalf of assistants.
Okay.
So the grouping that in the southeast, we don't know their compositions. What we are keen to know is our membership being used in that form and manner in order to risk their job and even risk their working relationship with their employers. These are things that we are frowning because the bulk of the blame will come back to we as national leaders. So this is the point. The issue that
And do we know how many are they?
so in the southeast, according to the data that I have here, the adjustment data, it was for 8 counties. And those 8 counties were not only the southeastern counties, they were Bapolu County, Grand Jide, Grand Cru, Lofa, Maryland, River G, River Cess, and Sando. Among those 8 counties, they identify about 825 persons that happen to be making below the $150.
Okay.
Those
From these counties.
from those counties.
Okay.
So those people, government told them, go and do your verifications for the ghost names. Because the Southeastern Network said that there were ghost names in the counties, that they were not working, but they were getting the pay. So government told them, identify the ghost names. So when they went again without even involving the national leadership, they want to identify ghost names, they sent it to national. And national deleted, which is Minister of Finance.
So what I mean, why should the leadership be sectionalized in the form that there is a network in Southeast?
Yes, so
and you have a national leadership of Health Workers Association.
Yes, so there we are coming in, right? So if you do it that way, it's not even organized. The ghost name that they send, the very ghost name, people surface that, oh man, you deleted my name. And they have to send another mail saying that the ghost name will send, there was an error. So government will have to also reinstate some of those names. So they have been like back and forth among themselves.
Without
us knowing anything about it. And those very people that they took their name from the payroll engaged us. Oh, we are part of the group, but the people went to where and they took our name from the payroll on ground that we are ghosts. So these are issues that we're facing. And let me tell you this verbally for the record. We have been engaging the government constructively and consistently on the issue of reclassification of healthcare workers. And government have kicked off the process of reclassifications. That process is currently ongoing with CSA and one of their consultants. We have been invited on several occasions. What is left out now is to identify, funding for it to be validated. Because imagine if you are a PA, you got different category of being specialized. You can be a ophthalmic PA, you can be a mental health PA, you can be a PA with non-clinical specialty, which include maybe public health degree, for example. But then, if you just go ahead and advocate that we want salary increment, those technical issues are not going to be looked at. And it's not going to be holistic. And as a president, we don't only speak for the Southeast. We speak for the entire country. What is even happening in the Southeast is even worse in Cape Mo County. So in Cape Mo County, they got people that are also working and making $100. In Foya Boma Hospital, that they claim that they have also adjusted, they got somebody there making $150 as a PA. In Bon County, they got somebody working there making less than $200 as county clinical supervisor. So it's not a one county thing or a one session thing. It is about us sitting down on the table so that we can identify all of those cross-cutting issues that are affecting us and go for short-term, medium-term, and long-term solutions. But we cannot temporarily solve the problem today and tomorrow another problem busts up. So we told the government they are making our job very difficult. The fact that they are thinking that when they grab the southeastern, it means that they have grabbed the entire workforce. Now it has reached to the point. So we are not saying again that the extract actions are wrong. The extract actions are illegitimate. They are very legitimate, but they are not the rightful path. They should use the national leadership, and then we know how we have been engaging government, and we'll kick off from there.
So what is your message to them? Cut off this crack action right now and channel all grievances through national leadership.
So our message is very clear in the press statement that we read. We are not aware of any crack action that is going on in the southeast. Therefore, we ask our membership to remain to work. If you should not go to work, you should hold yourself to be blamed. We are not part of that plain strike action. Anybody wanting to strike can use those counts and bring it to us, and we now solicit it across the country. Remember, we are members of several umbrella organizations, and those umbrella organizations will be there with you consultations. So we don't just wake up in the morning and say today is a strike. No, we don't work in that form of manner. So we denounce this, that we are not part of that strike, and those people that are calling the strike should call it off with immediate effect. But we know that the strike didn't start anyway, because we have already turned our membership to go to work. So all we can
do you get the indication that they are going to work.
Our memberships are going to work.
When you say your membership, what are you talking about? Those
our memberships are all physician assistants in the country. I'm the president for all physician assistants in the country, and I am the official spokesperson for them. And likewise, my colleague Ben is the president for all nurses. So if I tell my colleagues to go back to work, these are people that elected me. They should hear from me before they go into strike action. Once they didn't hear from me, they should not go into strike action.
Yeah, that is the end. Ben, let's hear you.
Prior to the press release yesterday, Liberian Nurses Association is fortunate to have what we call county chapter chair. So the county chapter chair relates directly to the vice president for operation, who also relate their information over to me as president. So when I heard of these great issues, I consulted her. She said she's not in the know. So I began taking my own phone to call them directly. I called from Grand Leader. Gideon Tente is telling me that he's not in the know of the strike action. In fact, he had told them this over and over, a fragmental action put the job of the nurses at risk. I went to River G. I called
not just the job of the nurses, but the life of the patients.
Yeah, the life of the patient also as well. I went to River G. I called Sawo Koyen, and Sawo told me he's in Bon County, but he's gonna call in the county. But however, the person I think he played had not given him any other thing like that. I called in Sino, Roslyn Topa, Roslyn Obo. So I'm in Wood coming, but in fact I'm not in the know update. But this is our FJ, but she also the nursing director for FJ the guys are going to work. I heard similar thing in the counties, but I was not consulted. I called in Maryland, Anita Jala phone was off. I called in Grand Crew. And Andrew is telling me that, oh yes, it is true. I want to do the signatory to that because the government is not did that. Then they gave us that computer. We did it. This thing was sent to them. They are not listening. They gave you computer. Even we are not even know they gave you computer. They gave money. Oh, I don't even know. That is not even the problem. But why couldn't you tell me? Oh, but you call me. Oh, I should call you. You are my principal deputies in the counties. When there is the issue, you don't think you need to tell me? Okay, so it is the only county that are not signing it. All the other counties. So that's tell me that my guys are not in consultation with the go slow. That actually tells me. So I was like, okay, when you do that like this, your own safety is not a show. My major thing is their safety.
When you talk about safety, what are you talking about?
The issue is, if you don't necessarily go slow, why do you think your employer would not replace you? And if they replace you, what happened to your job? When I say safety, not what their life, but it's their job. Their safety of their job. It's not their life. But If you just unnecessarily strike in one county, what may you think government can take 2, 3 cars from here and go and replace you? So what happened to the job? So not do it holistic. We will do it the entire countries. I think it will be more. You have more protection than single-handedly just leaving and going for go slow. That was when I say safe. That is from the point I'm speaking from.
Okay.
So the strike was not done in consultation with the other guy, and but that had not even been one of my major problems. You have said you want to dialogue. You agree with government to dialogue. They have transported you. You en route. Why can't you wait for the result of the dialogue before if you instituting the go slow you do? Why can't you wait for the result? But you are saying while you are en route, the strike should occur. In my mind, it's not fair. That one of the major things I said we say in our press release. It's not fair. You want dialogue. The next person said, yes, I want to dialogue. If you want dialogue and the next person want to dialogue, I think there is no issue because you want dialogue. And the government says, yes, come on, dialogue. So that one thing is the issue. There is no issue. So if why would you just want to blow unnecessary stuff or making the system look like if nobody wants to listen to you?
So moving forward, I think the root cause of all this is the fact that we have a network on its own operating in the southeast. Is it the only network?
For now, that's the only network. But the grant giving it, we are hoping and praying that another network won't pop up in Lofa because that's enough. We are hoping and praying that another network won't pop up in Nima County. We are hoping and praying that another network will not pop up in Grand Cape County to watch. Because if you took government money and give it to them and you give them laptop, you say go and do things. In my mind, another person say, but when we do similar thing, but that thing we are already discussing and we are jump over it because they acknowledge that it was wrong, that they happened. So I don't want to keep dwelling on it. Because if we do it, network will pop up everywhere. In fact, national leadership become irrelevant. So that was acknowledged yesterday. That only in the meeting day before yesterday, that was acknowledged, and we jump over that. My major thing is you want dialogue. They have given you means for dialogue. Come and dialogue. Hold on to the strike action. Don't initiate the strike action. I doing so will be illegitimate and will put a job at risk.
Okay.
Yeah, so the issue of strike actions are meant to call your authority to give you an attention, to open room for you to talk on the round table.
Mm-hmm.
But then while you planning, and then they already call you to town so that we can sit and talk.
Okay.
So it is fair enough for you to go to the call, listen to the call, even though they didn't respect us, but we were called to be part of that discussions.
To gather in the process.
Yes. It means that government is willing to do just what we have been thinking behind them.
Okay.
And now, the issue of striking in country, especially among healthcare workers, it have also been another challenging part because government also is not doing too well when it comes to listening to the leadership of those various healthcare workers. When the people knock your door, it's not for bread, but they are there with issues. Some of those issues only need clarifications, and no clarity will go to our membership. And when the membership here, at least it will ease the tension. But if you cannot handle it at the incubatory stage, it's going to germinate, and the fruit of that seed might be bad. So moving forward, there is no further different associations that we recognize as a network in the counties rather than the county chapters. We got our leadership structure in the counties. The physician assistants are represented by a county chapter leadership. And all the counties that they name, all the chapters that are there are frowning at this action because they are not in the know. Even if you look at the leadership structure of those people, it's not being holistic. Because if we talk about healthcare workers, it's not only the nurses, it's not only the PAs, it's not only the lab or the midwife. We got other people there. environmental health technicians. They are all there. But you don't see a representation in that. So because they are not fair enough, that's why they're doing what they are doing. So we feel that they are using our membership in order for them to reap what they want to reap for their own personal gain. Let me tell you something. In among our colleagues in our network, there is a division.
Mm.
The spokesperson and the chairperson have been expelled from among them. Are you kidding me? Healthcare workers should be behaving in a form and manner, forming different functional group.
So let's look at the danger any kind of strike action right now will pose to the lives of patients.
So let me come to before the danger, like let everybody honor our voices, actually understand, we acknowledge the plight, like you rightly said, things are not fine. If you go right near your Kimon, the last time I was in Lufa, I was in Kimon, we have meeting in St. J, St. Timothy, Tierney, Kinjo, Lufa Bridge. You got people over there making a low at $100 with 3,000 liberty. That if you were just talking about 4 year boy man, a PA they're making less than making around $150. So salary issue is an issue for every one of us. It's bad for all male level clinicians. It's difficult. It's not good for our working environments are bad. The terrains are bad. All of these camps are actually legitimate. However, the minor is the problem. The minor come let everybody dialogue. And we are already been engaging, let other people engage in the process. If you just going slow by now, I don't want to talk about the election and this that. Let all of us not allow politicians to use us. As we are not for CDC, we are not for UP, we are not for ANC, neither are we for any political party. There is no CDC patient, there is no CDC disease, there is no UP patient, there is no CDC, no UP disease. We are non-partisan. We're here to cater to the health needs of our people. When there is a need for us to strike, let's do it as a country and not few counties. Because the very thing you're talking in our county exists in other counties.
So I was asking about the rigs.
So the rigs.
Yeah.
Under the rigs one, there are several rigs that you consider.
And what does your law as a leadership say about when do you strike?
Good. So
it seems as if strike actions now are being weaponized.
Yeah, let me tell you something. Politicians are only listening to strike actions. That's why you see.
But I mean, when do you take that route?
No
diplomacy. After diplomacy,
fine. There is no specific time, right? Yeah. But when we are exhausted every meeting, that is the reason why I partnered in my release say, come let's discuss. When it is very necessary that in the countries we have talked and we tired and we feel that only strike you can listen to, obviously we will strike. Whether it is on election day, whether it before election day or it is after election day, but let it be holistic. Let it be national. Let everybody agree to it. Let it come only when the person you're talking to have refused to listen to you. Fine. So when we strike,
in this case, the government has not refused to listen.
No, not exactly.
The government is inviting you for dialogue.
So let me provide you
exactly.
That's the
problem.
Yeah.
About our previous strikes that we had. We had struck for insurance, and government listened to us. Provide insurance and that insurance.
Theophilus, let me just hold you there because I've been behind the scene making contact with the Deputy Health Minister for Administration, Deputy Minister Nouha. She's on the line. Minister, good morning and welcome to the show, and thanks for picking up my call.
Good morning and thank you very much. How are you?
I'm fine, thank you. I'm sure you're following what's happening in the Southeast with health workers there. Planning a strike action, and I have officials from the national leadership of the various associations of these health workers distancing themselves from the strike action. As it stands now, from the angle of the ministry, what's being done to ensure that these health workers don't go on strike?
Well, thank you very much for this opportunity. I think when issues like these happen, they're of national concern. and we have a responsibility to ensure that people get what they need when they ask for it, but we have to do it systematically. If accountants go on strike, nobody dies. When healthcare workers go on strike, people die. So I want to say thank you to the leadership of the different organizations, different associations, the Liberian Nursing Association, the Medical Lab Technologists Association, the Physician Assistant Association. I just want to say thank you to these groups so much for everything that they've done, to calm the situation in the Southeast. I want everybody to know that we have heard your plight. We've been having these discussions for months now, and the government has made some headway. We've done a lot to ensure that people are comfortable in the positions that we hire them for. Over the last couple of months, we have made several. We have made several adjustments in the salaries of the people who are in the areas that are considered hard to reach. There's been several upgrades. As I was explaining to the guys that are on your panel this morning, upgraded the salaries of about 834 people from 8 counties. We're working along with Finance Ministry and CSA to ensure that the people who are doing the work, those who are in the trenches, those who are in those areas that are so difficult to reach, that they can safely and comfortably work and to be able to provide for their families. So as the government works hard to ensure that all the steps that we are trying to make come to fruition, we're calling on the health workers to please go to work. Please try and focus on reducing deaths in Liberia, and let's get around the table and see how best we can meet your need by dialogue and not by strike.
Why the aggrieved health workers in the Southeast taking this action? Because you talk about 824 health workers, 34 that were absorbed on the payroll. Were they not impacted by that process?
No, I said upgrades. So we upgraded the salary. So those who were below 250, those in the appropriate categories. For example, if you were a nurse and you made below $250, we brought you up to $250.
Okay.
The second case were those who needed to be, if you were in the $300 category, but you were below 300, we brought those salaries up. So that total number of upgrades came to about 834 people, and not only in the Southeast. We've also upgraded the salaries of people in Lofa County.
So what is the issue of these people in the Southeast?
The Southeast, they complain about salary disparities. They complain that they're unhappy with the insurance that they have. They want to renegotiate. They complain that there are volunteers that need to be absorbed on the payroll. So we're looking at all these issues. We've met with Finance Ministry and CSA. We've been meeting for about a week. We made sure that the leadership of the Southeastern Association was able to come to town. I think they're all in Monrovia today. So we'll get around the table and go back to the drawing board to look at what these specific issues that they're talking. Because sometimes, it's lack of communication, or it's a lack of understanding of what has happened. So, we just need to sit down, and I'm sure at the end of the day, they will see what the government has done and gain an appreciation for the sacrifices that we're making. Because every time you have to upgrade salary, if it's not planned, you're taking money from somewhere. In Liberia, they say, to cover who. We don't want to keep doing that. We have to be strategic. So,
have you gotten information from the Southeast to see if the strike action is in effect?
So far, everything seems to be calm. Everything, I've spoken to some people this morning. I haven't gotten any reports yet. So things are calm.
And one of the just before we leave you, Minister, one of the problems that these two officials from the national leaderships of the various associations have is you authorities directly talk to these authorities of the networks instead of themselves. So this is where the breakdown of communication and having everything aligned is causing a problem, because if you leave them out and deal directly with authorities of these local chapters and networks, now it kind of difficult to ensure that you have the required documentations and names and all that.
I totally agree, and that's a fundamental flaw. That's a fundamental flaw. That should never have happened. So the government takes full responsibility for that. We have spoken about it, CSA, MFDP, Ministry of Health, and we have decided that we will go systematically. We will use the platform that has already been set. If an association has a head, they voted that person in, and so we have a right to make sure that we're going through the proper authorities instead of having this knee-jerk reaction to problems. Every time something happens in the southeast, everybody bends over backwards and moves to the southeast people. Well, suppose it starts happening all over the country. What do we do? Okay. There's a structure in place that must be followed, and I think this is where we're going to avoid this fragmentation.
Thank you.
Approach to solve problem solving.
Thank you so much for speaking to us.
Thank you. It's been a pleasure.
Okay, well, she's the Deputy Health Minister for Administration, Minister No Howard. I mean, she considered to your fundamental arguments concerning that, and I think there should be a system put in place where you all be part of the discussion from the very initial stage.
Exactly.
So.
Before he come, you hear from the ministers that they have started dialogue, right? To acknowledge what we said, that they have started dialogue with them. They are facilitating their transportation to town. They are in town. So why were you en route and you still insisted that go slow occur? That was the reason. That was predicated upon that they press release yesterday. It would not be fair. You are en route coming. They are facilitating your transportation to town for dialogue. Hold on to the strike till you see the outcome of the dialogue, or else you would not be fair to the next person, the next party who negotiating with you. That was the major reason you see all here.
Okay. Yeah, it's you.
Yeah, so the risk issue with our colleague in the South is, you see, when you strike in, we as healthcare workers, you will be putting the patient's life at risk. And that's why we want to use track to be the last mentor. We always engage with diplomacy. We write letters, we follow up. If you strike at the end of the day, you still come back to the round table. So if people opening their arm to dialogue, it's better to go into the dialogue and see the outcome. So another risk is to yourself. If you are not, channeling diplomacy and you want to always engage with strike issues, even your employer to some level will not be comfortable with you. And even you put your leadership at risk. Because whenever you are appearing before them, the brand you are, maybe you are a troublemaker. That is not a good thing for your own, career path. Because you need prospect at job site. You need to grow. And growth comes about recommendations. Once you are not recommended by your immediate supervisor, you are not going to grow. So that's why it's very good to maintain a cordial and good working relationship with your employer. While it is true that we are frowning at the healthcare workers, we also frown at government for solving issues in fragment and sectoral form.
Okay.
You solving issue, find a lasting solution. We're talking about the insurance, what government responded. Because the first track, government responded by providing insurance for us. And the insurance, now we are talking about the quality. And we are talking about the environment. Some of them are in Babulu. Can you imagine Babulu got one public facility which is Jala loan? You are deducting their money for this insurance, but they don't have no hospital that is covering them. So you see now, our healthcare workers are putting under pressure that they cannot be paying for this insurance, while it is that they are not benefiting. And this particular SAR insurance is an insurance that we need to renegotiate. It should be part of the immediate solutions. Because if I'm making smaller money and you're cutting out money for insurance and I'm not benefiting, I will feel that you are suppressing me. And that which we're talking, I think with this, we are going to lay to rest and I believe in what the deputy minister have said, and I know that we are going to sit on the round table, and those things will be discussed not only for the Southeast, but for the entire health workforce of this country.
Okay, let's see if we can take calls. Call us on 080-514-096. 080-514-096. My guest this morning, Benjamin Suamey, the president of the Liberian Nurses Association, and Theophilus Fire, the president of the Liberian National Physician Assistant Association. Let's hear from this person. We hope to get even calls from nurses in the Southeast. Good morning.
Good morning, sir. How are you?
I'm fine. What's the name?
This is Abenigo Newton. I'm a resident of Congo, but currently I'm calling from Smart Junction.
Yeah, go ahead.
I follow the genesis of the show. I think what are we are very getting for the people?
Say?
The minister a video to the government for intervening in the matter. Because this time around we are elections and we don't want any issue to come.
Okay.
The election, we want everything to be cemented into effort, into resolution making. Thank you for the time.
Thank you. Thank you. Thank you so much. Good morning. Good morning. Morning. Hello? Okay, call us on 080-514-096. Good morning.
Good morning.
Morning.
Yeah, this is senior.
You say?
Yeah, thank you so much, and also thanks for my brothers for there. And we have an issue of which we discussed last night, which I believe strike as compelling and that. And another issue here that we need to address holistically how to do with this issue of respect. If our brothers over there say they probably never respect them, in a conversation from the beginning of the show, I did also mention Nahu. Nahu is the member of all of the association. If you saying that the Southeasterners didn't respect you, you call Nahu to a dialogue when we was invited to the ministry, to the CS. Did you ever call Nahu? But this, the whole thing has been politicized. Why am I saying this? Because they are using the association in a sense to break the way of Nahu. That's why they think are going away. So you have to try to able to stop assassination. Just give a comment if you think that you have control over them. I'm saying this to say, when things are not done properly, I think we have to go back to drawing board.
Okay.
First of all, they are not going to have respect for the mother umbrella, and then they should demand respect for those that need their control. We are being disrespected in this regard. We need to put back on the drawing board. Thank you so much.
Thank you. Thank you. Morning. Good morning. Good morning. Morning. Good morning.
Hello?
Yeah, hello.
Yeah, good morning.
Yeah, what's the name?
Yeah, my name is Edward when you call from Police Academy.
Go ahead.
Yeah, this is thanks to our fellow that are in the studio. We say thank you very much to them because this is hard leadership of the year. So we say thank you very much to them. One of the problems I have with them, you see, most of the hospitals, clinical government hospitals, and things, most of the nurses and doctors left. They think I went to the clinic. They have the medicine in their bag. That when you go to Africa and when you go to the hospital.
Okay. Good morning.
Good morning, Varflay, and good morning to your studio guests.
Let's hear you.
Physician assistant, I just like to weigh in quickly.
Are you from the Southeast?
No, I'm not from the Southeast.
Okay.
I just want to add to the voice of one of the previous speakers. The official spokesperson of health workers in Liberia, especially for mid-level health workers, is NAWU, the National Health Worker Association of Liberia. I do appreciate my two colleagues that are in studio to kind of weigh in on the topic, but I thought that a representative of NAWU should have been part of the team. So can they just tell us if they ever pass this information by NAWU, and why is it a member of NAWU is not part of the team, which is our official body? Thank you.
Thank you. Thank you. Good morning. Good morning.
Good morning, sir.
Yeah.
I'm Pastor Eva McGill.
Yeah.
Yeah, I just want to give my own contribution. First and foremost, I want to applaud the studio guest there for amicably disseminating the information to the Liberian public. But the fact of the matter, we all as Liberians have a responsibility to making Liberia better. And we need to stop infringing on people. You know, it's very grievous for people to work at the end of time, coming out to meet up with the ends meet, they cannot get it at the appropriate time. And that stimulates people sometimes to get off position. And those of us who's having public offices, and we need to know that we are responsible and we are accountable to our people. So we should see to it that the right thing be done. That will make us to be professional and people who are responsible. For me, I would want to say that they should look into the people problem and solve those problems so that we can help to minimize the kind of every time the other strike coming on, the other one coming on. It's not healthy.
Okay.
And we can be responsible people who are very much educated into a very discipline and to align this kind of dissenting applications is wrong. So I just want to say thank you, and they should see to it that those things be amicably addressed.
Thank you.
Thank you.
Thank you. Thank you so much. Okay, gentlemen, we can respond to the concerns from the callers. Then we end up.
Okay, so I see my brother writing, but let me see. We can take it a little bit very diplomatic, and they're not the concerns. I were legit, and for the last quarter, that is the reason why we discuss every day, and then you hear it from the tone that the discussions are ongoing. The concerns of you guys are very legitimate, and we stand with them, and we ensure that when proper dialogue method is taken, we will ensure to the last day we will be with them. The issue of National Health Worker Union and my fellow PA that talk about the officials, well, I don't want to really dive in it too much, but if I'm not a PA for Liberian Nurses Association, they so much objective is welfare and advocacies, and so when I see the life being endangered, I actually got to be proactive to push in it. For National Worker Union not being invited in the meeting, we actually was not the organizer of the meeting, and as such did not have control over who attends the meeting. And so we could not say, I personally, as president for the Liberian Nurses Association, would not say I am not attending this meeting because now National Worker Union is not attending the meeting. It means that I really will be disregarding my function as the president of the Liberian Nurses Association. Who organized the meeting and want National Worker Union to be, the same invitation extended to me will be extended to them.
Thank you.
Thank you very much. You know, let me take this time first to educate some of our colleagues, especially for the PA that call. When we talk about NAU is a union. And NAU acknowledge the fact that we are the board members. But this is the point. When you are elected as a president, you are elected for an institution. And that institution membership become your constituents. NAU is speaking on behalf of my constituents. And my constituents are affected. Should I sit as a president of that institution, not advocating for my membership, but waiting for NAU to speak for them? My constitutions of the Liberian National Physician Assistant say no to that. The Constitution empower me as an official spokesperson for the Physician Assistant Association. And the membership of the Physician Assistant Associations can subscribe to NAU through me seeing the welfare being in the interest of what NAU is discussing. But as it stands, when I was invited as president of the Liberian National Physician Assistant Association, not NAU leader. So moving forward, I declare that NAU is an umbrella organization, but it doesn't mean that I'm going to be silent and not talking for my organization. That should be erased. The senior assistant in Liberia, I still have a control and authority over them. Now is an organization that we're subscribing to. But until then, we don't want to talk all things out here. So we want to table that and let now leadership be the one engaging other than those that want to cry for now. We know what is happening. So we don't want to go into the political scape of the health workforce. We are strictly professional people and we're here for our colleague welfare. All associations' rules are to advocate for the welfare of your organizations. The board's rules are to advocate for the regulatory activities of that profession. So we as advocates, we are there seeking the welfare of the physician assistant in the country. If it is genuine, now we don't speak for only PA, now we speak for both non-clinicians and clinicians. And I am more specific about the PAs. I'm not speaking for everybody. So I know my line and there where I stand.
Okay.
Thank you very much.
Okay, gentlemen, we already are out of time, but I want to thank all of you for coming this morning. Your parting comments, I can start with you, to you before Ben.
So thank you very much. My parting comment, let me say thank you to all physician assistants in the Southeast that are under my voice and have listened to the press release that was sent out yesterday evening. It was meant for their own safety, and in the issues that affect them are still be looked up to and they will be updated duly. Remember, we didn't say it's not necessary to strike, but we should organize ourselves after dialogue if the dialogue fails. Dialogue is the first way, diplomacy is the first way, and radicality is the last. So we don't want to use radicality at this point. Thank you very much.
Thank you so much, Ben.
Okay, so thank you ever so much for hosting us, and thank you for making sure that our voices are heard. And I want to tell my colleagues in the Southeast, my nurses in the Southeast, your reasons are very genuine. As the minister is acknowledging, everybody's acknowledging your reason for the strike. Your reasons are well taken in. But we are saying, do not engage in the strike until your colleagues who are on their way for the meeting can get back to you. It will not be fair enough to open up dialogue, and at a certain point in the dialogue, you say insist you will go slow. If you do it so, it means the other party of the dialogue will not actually feel fine. They have called your leadership to come over for discussion and know fully well that that discussion is not cast in stone as it affects the entire country. So the discussion, I'm asking you to talk to your colleagues to come up with open mind that will always sit on the drawing table to ensure that those issues put on the floor are discussed one by one, with open mind. Thank you for the provision. Thank you for the sacrifices. Thank for all that you are doing, and thank for the support you provide to all as their leader. Thank you ever so much.
Thank you so much. Well, they are from the he's Benjamin O. Suamey, the president of the Liberian Nurses Association, and Theophilus Fire, Liberian National Physician Assistant Association presidents. They've been here as my last guest. You can join the show tomorrow